Okay, this video is going to be about Harold Ridley, the hero of cataract surgery. The first thing I want to show you, though, is this guy Semmelweis, Eugene Semmelweis. He's the guy who figured out you need to wash your hands before delivering a baby, and that lowers the death rate of the mother dramatically. Okay, it was completely obvious the doctors were going for an autopsy straight to deliver babies without washing their hands back in the day in the 1800s. He figured it out. And when he told them, they got so pissed off at him, he got fired from his job, he got put in an institution, then they beat him up and they killed him, okay? And so what I'm trying to tell you is, in medicine, I've been a doctor over 30 years, when you do something good to improve things and help the patients, you get a piss flood of wrath from the upper people in medicine because they've got prestige based on keeping everything the way it is. When you improve something, you basically show that they were ignorant, they didn't know how to improve it themselves. They feel embarrassed. They probably don't make any money off whatever new you're doing. Maybe they lose money. They certainly, in their mind's eye, feel they lose prestige. So they attack the person who makes it better. The stupid public, it annoys me. They always think, oh, medicine's there to help them. No, nobody gives a rat's tail about you. You're a bunch of poor people, okay? The system's designed to pick your pocket. It's not designed to help you. Okay, so anyways, I just want you to say you have to understand Semmelweis. Think of that not as an unusual thing. Think of that as a typical thing, okay? And I'm going to show you what happened with the invention of cataract surgery. The way I got started on this is I was just reading this book. You know, my eyes almost, it's improving, but it's still pretty messed up. My blepharitis episode. And I'm just reading this book about eye doctor Andrew Lamb. It's a pretty good book. I'm only really sort of beginning it, called Saving Sight, but it's good. You know, he knows what he's doing writing the book. He's putting it together well. So one of the early chapters was about cataract surgery, and here's the guy. This is Harold Ridley. He was a British ophthalmologist in the mid-1900s, okay? And he was trying to improve the residency training program. And in so doing, he totally pissed off the boss of the residency program, a guy named Dr. Stuart Elder. And then that guy just screwed him over wherever he could. And we're also going to have to talk about the fighter pilots, for the Royal Air Force in Britain. This is a Spitfire plane. There's a glass canopy above them made out of plexiglass. And the pilots normally wear goggles, okay? This is what a cataract looks like. It's sort of a clouding of the lens, decreasing vision going through the pupil. Okay. Okay, here's an example of one of the early forms of a cataract that could be implanted in the eye for vision. Up until this time that he figured out how to do all this, no one ever implanted anything into the eye. No one thought it was possible. Okay, so now here is the evil villain of the story. This is a Dr. Stuart Duke Elder who was knighted, okay? And the guy was a total weasel. He just screwed over Ridley and tried to block everything he do. He was able to get him sent to a bumfuck terrible spot for part of World War II. He just went out of his way. Because Ridley had tried to improve the residency program and it pissed him off, he did everything he could to ruin Ridley's career and block him from developing a method to improve cataract surgery. And I'm just telling you, this is not a strange story. This is typical. This is why anybody who wants to invent something has to immediately just accept the fact it could be the destruction of their career. Literally, the destruction of their career, loss of their job, getting in trouble, attack by the upper echelon of medicine. It's like if you're a great athlete, everybody likes you. The players, the coaches, the fans, the owner of the team, they'll say in pro sports. In medicine, it's not the same. If you're a genius in medicine, you do something great, they hate your guts and they attack you. This is how it is, okay? Medicine is not for helping patients. Medicine is for making money, okay? If what you're doing makes money while it helps patients, that's okay, that's fine. But it better show money making right away for the people in charge or you're going to run into a shitstorm. Okay, so a couple things about it. Cataract surgery in the early 1900s, it was kind of barbaric. They would just poke a needle in there to pop the lens posterior. That's called couching, to push the cataract lens out of place, to have it stop blocking the light coming in, but the vision was terrible. Then the next thing is they gradually learned how to do a big excision and make a big surgical incision and then cut the cataract out. But that left the patient with no lens, and their vision was terrible. They give them Coke bottle glasses, but their vision was still terrible. And then Harold Ridley came along, and World War II ended up giving him a big idea that improved cataract surgery. So at that time, the Germans were trying to put the crush on Britain. So they would fly in on these bomber attacks. What these are called Heinkel bombers. So the bombers would come in, and relatively low with all their stuff, and then the Spitfires would be scrambled to go up and try to shoot down the bombers. But they're not going to make it that easy. So here's a Spitfire being scrambled to come up, and these guys are the big heroes of Britain, obviously, because without them, Britain would have been destroyed. You can see the canopy overhead. You can see the goggles that he's supposed to wear when he's engaged with the enemy. So here's a closer look at the goggles, and they need that to protect their eyes, because you can imagine what would happen if a bunch of bullets come into their plexiglass canopy and it gets shattered and it goes into their eyes. That would not be good. So here are the German Me-109s, they call them Messerschmitt 109s, and they flew a little bit higher above the Heinkel bombers, so that when the Spitfires would interpose trying to shoot down the Heinkel bombers, the Me-109s would come in and then shoot down the Spitfires. So what had happened was one of the British pilots, a guy by name, his nickname was Mouse, last name Cleaver. Mouse Cleaver got in there to shoot down a Heinkel, and then an Me-109 got on his tail. In the hurry of being scrambled, Mouse Cleaver forgot to wear his goggles when he went up into the plane. Then an Me-109 came in on his tail with the sun behind him, and his machine guns fired, and they broke up the plexiglass canopy of the Mouse Cleaver's Spitfire plane. And at that time, he didn't have the goggles on, so he got fiberglass shards all over his face. His face was disfigured. He was blind in one eye. He had just enough vision that he was able to see his way down to the land and land his plane, a rough landing, but still he survived, and he made it to the ground, okay? So that's what happened to Mouse Cleaver. All right, now I just want you to know that what happened then was Harold Ridley went and evaluated Mouse Cleaver, his face and his eyes. And he made a big observation. No one had ever implanted any device into the eye before, because everyone was terrified it would just cause a big infection. Then you'd have to enucleate the whole orbit. It'd be a big mess. No one wanted to do that. Everyone was terrified of infections. They didn't have good ways to handle them. So that's why, for all the cataracts, they just remove the cataract, give you big, thick Coke bottle glasses, say, yeah, your vision's going to stink the rest of your life. That's the best we could do. Okay, so this Harold Ridley guy, he noticed that the plexiglass foreign body sitting inside the eye of Mouse Cleaver wasn't causing any inflammation or infection. He's like, holy crap. The ocular globe tolerates a plastic, glass-like foreign body. He says, wow, that's extraordinary. Perhaps I could implant one of those as a replacement surgery for cataract surgery. So he started doing these in secret on animals, then he started doing them in secret on humans. And when the ophthalmology establishment sort of got wind of what he was doing, instead of saying, hey, that's a magnificent idea, let's develop it, they're like, oh, you're evil, you're malpractice, you're degenerate, you're sick in the head, no one can do such a thing. And they just screwed him over left and right and made him miserable, tried to run him out of town, ruin his career, mocked him. They would, when he came to the meeting to have his permission to present, they did everything they could to make it so as few people in the audience would be there as possible. Then they heckled and ridiculed him and mocked him and said, go away, you're a phony, you're a quack, you're a malpractice. I mean, it was really bad. They basically hated the guy for helping the patients, okay? That's how it is. And I'm just telling you, I've seen a lot of this sort of thing in medicine. The people who do something good get attacked. I can remember when I went to Harvard, there was this imaging guy and a surgeon over there, and he was the best guy. And all I heard all the residents and fellows saying was how the Harvard head professor guys hated his guts and were trying to fire him. And all of them said, he's our best teacher, he's our best clinical physician, he gets the best results, all the patients love him. And they hated his guts. You know, and I read the guy's papers. The guy was a genius. Okay. Anyways, here, I'll just show you what happened from all this. Harold Ridley successfully developed it. It took, instead of taking, the 5 years it should have took, it ended up taking him 25 years because they kept blocking him and hassling him. But it was finally proven that he was by far, had the best way of fixing cataract surgery. Take out the old cataract lens, put in a new good lens. And it took him a while to exactly get the refraction correct on it, but he did. And eventually it became accepted. It was improved since then as well. He got a cataract surgeries himself. And then he was knighted when he's 93 years old by the Queen. Better late than never. He died the next year at 94. But anyways, that's the story of cataract surgery, and that's pretty much similar to a lot of how medical innovations and inventions occur. So to innovate and invent something, it's not just a question of being smart and having a good idea and being tenacious. It's also a personal attitude of bravery. I am going to do what's right, even though I know I'm going to get screwed over. That's kind of what you have to say. And what can make a man do that besides Christianity, okay? That's why you're not going to see, that's why you don't see, that much innovation